Hi, I'm Hank Levin, and I want to give you a little demonstration of the InnerTrac emotional response indicator and see how it works with an actual person, and we will begin. We have Norma here, and who's going to be our subject, and I'm going to ask her some questions, and you'll see how the InnerTrac responds to the questions. And I might intersperse this with a few comments on how it's reacting and what to look for. Okay, so are you ready, Norma?
I'm ready.
Good. Okay. So, is there anything in particular that you wanted to talk about?
Well, I'm a little nervous right now.
Mm-hmm.
You know, like there's some element of fear here. Not much, but just a tinge, you know.
Okay. Fear about what?
I guess just performing, you know, in front of a camera.
Oh, okay.
Yeah.
Thank you. Maybe you can ignore the camera for a bit.
Okay.
Or if you want, you could just say hello to the camera.
Hello.
Okay.
Thanks.
Thank you. Okay. So, there was a little bit of release there, but not a great deal. Okay. We'll continue. So, is there anything that you have a particular issue with that you might want to address?
Well, I have had an ongoing issue with weight. I think that there's been some element of perfection in my family that you need to watch your weight. Don't let yourself go.
Got that. Thank you. Now, you noticed we started out about 4.8, 4.6, we came down to 4.3. There was a large discharge of energy there, okay, which confirms that it's an issue and that it's accessible to talk about. Okay, so tell me something about weight.
Weight is a difficult thing to control.
Okay, how so?
And sometimes it's mysterious.
Mm-hmm.
It's especially for me when I'm in a stress situation, I tend to eat to try and make myself feel better.
Mm-hmm. Okay.
So.
And how have you dealt with that?
I've dealt with it by substituting food. In other words, you know, you don't eat chocolate, you don't eat sweets, you don't eat ice cream. You know, you eat carrots, mm-hmm. or a piece of fruit, a pear. Try and keep the bananas down. You know, that sort of thing.
Got that. Now, time out. Mm-hmm. As Norma started talking about this, you noticed there was a large drop in a large discharge, and then at a certain point the white light came on, the release light came on, and I had a suspicion at that point as to whether just at that point, having looked at it and spoken about it for a few moments, there was a moment of release there. Okay, did you feel something happen like that?
Well, I thought, when I talked about my family and how they have this feeling of perfection and you have to never let yourself go, that was kind of a new thought for me.
Thank you. And you got a release light come on again as you talked about that. Okay.
Yeah, I guess I have some fear of judgment from my family.
Okay, and how does that seem to you now?
Well, it's easier, it's better.
So
I can feel it in my stomach, a little breathing, a little.
Is there new awareness there?
There is. There is.
Thank you. Okay.
Thank you.
Okay. I'd like to indicate I actually went past the point of that release because I thought we were going to need a longer demonstration, and then I started wondering because there was a rise occurring after the release, a rise in energy, and I thought maybe I made a mistake by not indicating the release, even though it happened right away. And so I went back and asked about it, and the release light came on again, which confirmed that I had actually overrun it. And when Norma talked about it, it came on again and indicated that there was a release there.
Yeah, I agree. I think that's right.
So, as short as it was, we would say that was a successful session.
Yes, we would.
Thank you.
You're welcome.
So I hope you got a chance to see how the InnerTrac works and how it can be used to guide a person in a session. Thank you.